Hello and thanks for joining us on the Wellness segment. I am Perpetua Fasa Repeater. An upper respiratory tract infection affects the upper part of the respiratory system, including sinuses and throat. Though upper respiratory tract infection symptoms include a runny nose, sore throat, and cough, the treatment often includes rest, fluids, and over-the-counter pain relievers. Joining us to shed more light on this infection is Dr. Olamiji Oluwagbemiga, Senior Medical Officer, Solid Rock Hospital. Hello, Dr. Olamiji. Good to have you on the show today.
Hi, it's good to be here.
Definitely. Well, our focus today is upper respiratory tract infection. What exactly does that mean?
Okay, upper respiratory tract infections are infections that involve the upper part of the respiratory tract. The respiratory tract is divided into two parts, the upper part and the lower part. The infections of the upper part, which is made up of the nose, the nasal cavity, the pharynx, the larynx, the upper part of the larynx. So those are the upper part. So any infection along those areas are referred to as upper respiratory tract infection, and including the sinuses also, the paranasal sinuses. So they are all referred to as upper respiratory tract infections.
All right, now what are the causes?
The causes are more of viruses, bacteria, and then fungi. The viruses account for most of the infections. Most of the upper respiratory tract infections are viruses, are viral in origin. So those are the causes of upper respiratory tract infection.
All right, talking about the upper respiratory tract infection, are there specific risk factors?
Yeah. There are some specific risk factors that predispose us to upper respiratory tract infection. The first is contacts. Since upper respiratory tract infections spread more from close contacts with people that have upper respiratory tract infection, predispose us to having it also. That's why it tends to spread in the family, in school, daycare, and where people are in close contact with one another. Another risk factor is inflammation, such as allergic conditions. Yes, allergic conditions like allergic rhinitis. There are some upper respiratory allergies that can mimic or predispose us to upper respiratory tract infection. So we have allergies, and then we also have asthma. Asthma tends to cause inflammations and thereby causing more, predisposing us to upper respiratory tract infection. We also have traveling. People that travel a lot, in the sense they are more exposed to a lot of people. So they come in contact, they go into public places where people actually touch, and then you touch the same place. People that have upper respiratory tract infection, probably the droplets, they are droppings from what they used to clean or what they sneeze into. So you may just have contact with it, and then you touch your nose or you take it towards your face, and then you contact it. Another factor is smoking. Smoking reduces the defense, the mucosal defense, the lining of those respiratory tracts. So the smoking impaired the defense. And then we also have some defects around the face, around the cleft palate, cleft lips, polyps, that's growths in the nostrils and all that, nasal polyps. They can also predispose to the increased risk of upper respiratory tract infection. We also have some people who are on steroids or that have received transplants. So those people are also at greater risk because their immunity is already impaired by taking such drug, or the fact that they've had cancer therapy or they have cancer and all that. So those are the basic, the common risk factors of upper respiratory tract infection.
All right, thank you, doctor. That's a lot. Now let's look at the symptoms of upper respiratory tract infection. What are the symptoms?
The symptoms of upper respiratory tract infections are quite common. We have the nasal discharge, commonly called catarrh. Then we have sneezing, cough, sore throat, fever on rare occasions. Fever is more common in children, not in adults. Then we have fatigue, weakness, which occurs sometimes. Then the muscle pains, which is also mild, not as much as you will find in malaria. Then we have nasal congestions and headache in occasional cases. Then the feeling of unwell, which is referred to as malaise.
All right, now when people have URTI, do they usually need to be hospitalized, or is it something they can manage at home with some remedies?
Most upper respiratory tract infections are self-limiting because most are caused by viruses. So, and these viruses, they are self-limiting. They don't cause serious infections. So most people diagnose this upper respiratory tract infection at home and get some medications like antihistamines and all that to help them deal with the symptoms. Those that present in the hospital benefit from counseling and then this supportive care, whereby you give paracetamol if they feel like feverish, or you give those antihistamines to help them curtail the secretions and all that. So it's on rare occasions that you see upper respiratory tract infection necessitating admission. There are few of such cases though, which will necessitate admission, like when we have the croup, though it's caused by viruses, but it can be severe, especially in children where it narrows the respiratory tract infection. Respiratory tract, it narrows it and causes a lot of breathing difficulties. So in such cases, you want to admit, like epiglottitis, you also want to admit, because those are severe upper respiratory tract infections, pharyngitis with superimposed bacterial infections. So those ones can cause sepsis. And some of these upper respiratory tract infections can also lead to lower respiratory tract infections. So those are the ones that would necessitate admission, or the ones that has complication of dehydration and all that. So, but rarely they cause complications. Most people most upper respiratory tract infection will resolve within a week or two. So the ones that last more than that will necessitate visiting the hospital.
All right, doctor, you mentioned something. You said self-limiting. Well, we're not talking to medical students, so I would like you to explain what you mean by self-limiting.
Oh, okay. What I mean by self-limiting is that the body can take care of it. They resolve on their own without needing any medication. So they resolve even with little or no supportive care. They resolve on their own. That's what I mean by self-limiting.
All right, doctor, I remember you also talked about the fact that sometimes if care is not taken, there might be complications, which could, of course, necessitate that the person comes down with the lower respiratory tract infection. Are there things that a person would do that would make those complications come up, or do the complications just come up by themselves?
Not necessarily anything the person did or have done. It just happens. In children, the complications are more common than in adults because children have lower immunity. or people that have their immunity is already compromised. So those people tend to have more complications than healthy adults.
All right, doctor, just before we wrap up this conversation, we'd like to hear a few thoughts from you. Maybe you just want to share a parting thought.
Like I've said, upper respiratory tract infections are self-limiting. They rarely cause complications. But when you notice high-grade fever, or you notice that the symptoms are getting worse, after 10 days, the symptoms are still worse, or maybe 7 days, progressing worse, then
if I get you correctly, doctor, you were talking about the fact that after 10 days or even 7 days, if the symptoms persist, that we need to see a doctor. Is that what you're saying?
Yeah. If the symptoms are supposed to be regressing, you're supposed to be having some improvement, there are things that will necessitate visiting the hospital. You discover that instead of the symptoms abating, it's gradually getting worse. So at that point, you need to visit the hospital, or maybe when you have high-grade temperature, high-grade fever. So you also need, in children with difficulty breathing and breathing difficulties, you need to visit the hospital. But generally, upper respiratory tract infections are self-limiting.
All right, thank you, Dr. Olamiji. Thank you for sharing your thoughts, and thanks for coming on the program today. Well, you heard it. Thanks for watching. I am Perpetua Fasami Peter.